Okay, welcome everyone. Thank you for joining us for our final e-learning event of our community-based research responding to crises series. Also our final e-learning event before we take a break over the summertime and return to our programming in the fall. We have a very exciting event today with three fantastic speakers that I'll be introducing shortly. My name is Amanda Demmer. I'm the Program Coordinator and Learning Specialist for Community-Based Research Canada. And I have with me today one of our volunteers, Natalie Nickel, who'll be helping out with some tech support and other things today. So you'll see her in the chat box throughout the event. Just as we get started today, you may notice that closed captioning has been enabled. If you're not seeing closed captioning, you can, on your Zoom control toolbar, you should be able to click the enable captions or show captions button. If it's not showing up for you, you may have to click the three dots that says more and find your captioning that way. We do also have translation available within our Zoom platform. So if you would like to have your captions translated into a language other than English, you'll be able to do that through the captioning settings as well. So you can choose the language you would like your captions to show up in. As we get started today, I also want to acknowledge that the Community-Based Research Canada Secretariat Office operates from the traditional territory of the Anishinaabe, Haudenosaunee, and Attawandaron peoples. Our office is located out of Wilfrid Laurier University, which is situated on the Haldimand Tract. This was land that was promised to the Six Nations of the Grand River in 1784. The Haldimand Treaty promised a tract of land including 6 miles on either side of the Grand River to the Six Nations of the Grand River, and their land now comprises only less than 5% of what was originally promised. We acknowledge this as we give thanks for the privilege to live and work on this land, known as Waterloo, Ontario, and recognize that as Community-Based Research Canada, we're committed to continually building relationships with First Nations, Métis, and Inuit peoples throughout Turtle Island, throughout Canada, as well as promoting research projects and approaches to research that actively work towards reconciliation. If you're unfamiliar to Community-Based Research Canada, we are a membership-based organization with a mission of advancing community-based research excellence in Canada by strengthening partnerships, building capacity, mobilizing knowledge, and championing community-based research among individuals, communities, and institutions. We are a social enterprise. We're funded entirely by our membership base. This is over 70 organizational or institutional members, as well as individual members. And as part of our programming that we offer, we host these e-learning events, as well as a community of practice. And you can check the link that Natalie will post in the website here to see our website, where you can find things like our upcoming events and recordings of past events and so on. In our e-learning events, we always, in the spirit of reconciliation, open the event by amplifying one of the goals of the Truth and Reconciliation Commission's call to action. This month, as we're discussing climate change and environment, and talking about land and how land is used and who has sovereignty over land, call to action number 47 came to mind for me. We call upon federal, provincial, territorial, and municipal governments to repudiate concepts used to justify European sovereignty over Indigenous peoples and lands, such as the doctrine of discovery and terra nullius, and to reform those laws, government policies, and litigation strategies that continue to rely on such concepts. Again, Community-Based Research Canada is committed to this continual reflection on the interconnections between truth and reconciliation and the various topics that we approach using community-based research. Our agenda for today, of course, we will have our wonderful presenters sharing their research work with us. After this presentation, we'll have hopefully about 20 minutes for a question and answer period. And during that question and answer period, I will be reading any questions that come in through the chat box for our speakers to respond to. If you do have questions that you'd like to ask the speakers, please feel free to put them into the chat box at any time throughout the presentation. That way, when we get to that question and answer, if there's already some questions that have come in, I can start with those questions. But you'll have a chance during the question and answer period to answer your questions then as well. We will wrap this event up sharp by 1 o'clock Eastern time, and a bit under an hour from now. I Very excited to now introduce our presenters, who we'll be passing it over to shortly, who are going to be talking to us today about their research that used mixed methods to co-create equity-informed emergency planning and policy by asking the question of what barriers prevent access to public space for vulnerable communities during extreme weather events, and how can this be addressed? They'll tell us about their research and how it has aimed to support governing bodies and service providers to better understand the lived experience of extreme weather events and design better policies and programs to help vulnerable residents prepare for, respond to, and recover from these events. So our speakers for today include Dr. Sarah Marie Wiebe, an assistant professor in the School of Public Administration at the University of Victoria, an adjunct professor at the University of Hawaii. Sarah's research focuses on community development and environmental sustainability. As a collaborative researcher and filmmaker, she works with Indigenous communities on sustainably themed films. She is a co-founder of the Feminist Environmental Research Network Collaborative. She's a collaborator with the Seascape Storytelling Studio, and she's also the author of several books. Joining Dr. Wiebe today is Erin Nuckols. Erin is a MITACs Postdoctoral Fellow with Dr. Wiebe. Erin earned their PhD from Virginia Tech University and holds a master's in public health. Their research has involved themes of care, cooperation, and collaboration, as well as nonviolent communication for social action and regenerative environmental design. Erin has researched quite a wealth of topics, looking at things like health equity, food sovereignty, cultural foodways, disaster response, and supporting Indigenous communities after forced removal from green infrastructure projects. Joining both Dr. Wiebe and Dr. Nuckols is Kristopher Peters. Kristopher works with the First Nations Emergency Services Society and brings to his role here over 19 years of valuable experience in the fields of project development, civil engineering, public engagement, and strategic planning. He hails from the unceded Coast Salish territories and is a registered status Indian with the Seabird Island Band. Kristopher has worked with numerous Indigenous groups across Canada and draws upon his engineering expertise and extensive social connections to bring to life projects that are beautiful and sustainable. He's always passionate about finding ways to give back to the community in a culturally meaningful way. Well, I will pass things over now, and we'll do a bit of a shuffle on the screen sharing here. And I welcome the three presenters to begin the presentation.
Thanks so much, Amanda. I think Erin's just going to pull up our slides here. Thanks so much for the warm welcome and introductions. It's such a pleasure to speak with you all today and to close out this really important series. And I'm so delighted to be here with Erin and Kristopher as well. So we convened a care assembly recently, just a few weeks ago, about a month ago now. And so we'll talk quite a bit about that process of convening policy and community leaders and researchers. So that's what the image that you see on the left here is, a visual representation that we brought to the care assembly. And we'll have some time in a moment to go over this visual together. So as we begin, we want to acknowledge that where this research originated at the University of Victoria is situated on unceded Coast Salish and Lekwungen territory, home for the Songhees, Wissepsum, and Esquimalt nations, as well as with Saanich nations. And as indicated on our website as well, we have an elaborated acknowledgement noting that our project does span the whole province of British Columbia. And so as we have moved through different conversations and caring circles, and with our survey recruitment, we want to be really respectful of the knowledge that we gather, really trying to be good community engaged researchers and not be extractive, and honor those stories and all that knowledge that's been shared with us. I also want to acknowledge that the origins of this project started with a government grant. The Ministry of Health put forward a call. And so in our research, we've been kind of responding to this call to bring an equity-informed approach to looking at specific barriers to safe space during extreme weather events. We're really fortunate to have a team. And so, in addition to Erin and Kristopher and myself, we also have a partnership with the Capital Regional District Healthy Communities Network. And our lead advisor there is Kirsten Ma, who's part of the Healthy Communities Network and is a Healthy Communities planner, as well as two members of the First Nations Health Authority, Casey Neathway and Caitlin Buxton Carr, who have been really, really vital in forming our advisory along with Kristopher. And that's the three of us there. So in terms of our presentation, we'll go over the question and some context, talk a little bit about the theoretical approach of caring democracy, but also its practical applications, highlight our methodology and methods, which does include mixed methods and community engaged research, highlight some of our preliminary findings with some discussion and conclusion. So I will lead off the first few sections and then hand it over to Kristopher to share a bit about his perspective and story, and then Erin will further share about the findings, and then we'll each have a few minutes to close out before we open it up to conversation. So as mentioned previously, the Ministry of Health, so provincial government ministry here in the province of British Columbia, put forward a request for proposals to address a few research questions. So this research question originated from the government authorities to look at what barriers prevent access to public space for vulnerable communities during extreme weather events. So you can see how that question is quite broad in scope. And so we sought to focus on a few priority regions, kind of based on our health authority regions in the province, including Northern Health, Interior Health, and Island Health, as well as having a partnership with the First Nations Health Authority meant that we're widening out our scope as well, sort of across the province of British Columbia. And so the first part of our project really involved growing our team. So bringing on Erin as a postdoctoral researcher, as well as a co-op student, Kavita Nahal, who we want to acknowledge as well, and then going through sort of ethical protocols to bring on board a partnership with the First Nations Health Authority, as well as the First Nations Emergency Services Society and the Capital Regional District. And then together we co-developed our instruments and methodology and strategy for the research. And so I mentioned earlier how I, in particular, have been influenced by the work of Joan Tronto. Not Jane, but Joan Tronto, who is the author of Caring Democracy, has a wonderful range of quotes to think about how can we create more inclusive, caring, democratic societies. And I like this quote in particular, noting that only a holistic and politically grounded rethinking of care can adequately address the present situation. And so much of our world and society is premised on sort of individualism, hypercapitalism, and extraction. And instead, we really want to bring care to the core of our ethics and our approach and relationship building. And so part of that care approach guided our methodology. So we've been using CARE also as an acronym in response to community actions and responses to extreme weather events. So on the one hand, we've been really influenced by democratic theory and deliberative democratic thinking, and also public health scholarship. So here on the right on the screen, we have some categories of public health associated with extreme weather identified here, including physical hazard during the event, exposure duration to the hazard, vulnerability of the individual and community, preparedness, management, and recovery capacity from the event. And we also note that it's well documented that socially constructed marginalization can be a barrier to medical and healthcare for individuals and communities. So in this study, we really make the links between health equity and vulnerability to extreme weather events. Also noting that vulnerability is not a blanket term, it's a contested term, and not everyone would self-identify as vulnerable, but that framing did come from the research question. So we want to be kind of sensitive to the diverse lived experience that different people and communities have in relation to various hazards, whether it's extreme heat or drought or wildfire or flooding. All of that is related to the scope of our research. And we really try to bring that equity-based intersectional approach to this work. So I briefly mentioned our acronym. So just elaborating why CARE is so central. Not only is that caring democracy ethic vital to the work that we do, but also CARE being community actions and responses to extreme weather event. And we convened, as we'll mention in a moment, just a few climate care gatherings and sharing circles, one regional circle in person, and then 5 online, and then one sort of culminating larger care assembly, and really trying to bring sort of an ethical practice of listening and learning and respect for people's stories and what they've been through and what they've experienced in terms of extreme weather, and then moving towards trying to identify and co-identify some recommendations and strategies and solutions to address them. So on the left here, you see an image from our recent Climate Care Assembly, which was held on May 16th. And this is from the Esquimalt Gorge Pavilion, which is a really wonderful facility with, as you can see, floor-to-ceiling windows. Kind of on the upper level, it overlooks the gorge, so a really peaceful venue. And so this venue we thought was well suited to having a mini public or a small gathering of policymakers from various government bodies, including the Ministry of Health, the Provincial Ministry of Emergency Management and Climate Readiness, as well as various health directors from several regions in the province, and a range of community leaders and some researchers. So we came together to discuss our preliminary findings, and then also in small groups had some facilitated discussion around some key themes, which we'll go over in a moment. But prior to this care assembly, we created a survey which has been distributed to over 400 emergency coordinators across the province, and also engaged in some qualitative climate care circles. And our first in-person care circle took place in the interior region at the downtown Kelowna Public Library, where we heard from some emergency coordinators and indigenous leaders about their experience with responding to and preparing for extreme weather events. And another sort of approach that really informed the way that we're thinking about also policy and practice is guided by a deliberative policy analysis lens. And some of this work is influenced by scholars like Frank Fisher and other interpretive scholars who talk about the importance of deliberation to discuss really complex, tricky issues. And in all this work, we're seeking to balance, the urgency of responding to extreme weather with really careful consideration, thought, and deliberation about how better to plan and prepare for these events. So we are trying to bring that deliberative ethos to this work. And part of this process meant an emphasis on policy listening. And so by inviting some of the policymakers to this gathering to kind of co-create strategies and responses to our research question, we engaged in this practice of listening. So we tasked a few of the policymakers with reporting back what did they hear, and kind of really trying to listen deeply during the care assembly, and then at the end sort of reporting back on some key messages and themes that they heard. There is a wide literature on citizens' assemblies and deliberative democracy, and there's a great resource that I'm sure many of you are familiar with called participedia.net that has a kind of archive of all of these forms of deliberative processes around the world. And so that sort of ethos definitely influenced the design of our care assembly. And in terms of the practical aspects of our design, we're also really guided by the work of Dr. Sasha Costanza-Schock, who's a scholar at MIT and has written a wonderful book called Design Justice, Community-Led Practices to Build the World We Want, which is a really wonderful book, one that I include in pretty well everything I'm writing or teaching these days. And it really emphasizes co-creation, participatory process and action, and making space for storytelling and various stories to highlight some of the lived realities and experiences of extreme weather exposure. So this is a great segue to kind of wrap up my 10-minute introduction here to ask Kristopher to share a little bit about Kristopher's experience with the project and what brought Kristopher to this work. And on the left, you actually see an image here from our first climate care gathering in Kelowna at the library there. So Kristopher, over to you, and thank you so much for being part of this today.
Good morning. Lawete Swale, Christopher Peters, Teltsweet. From the Tutelo Nation, which is a Coast Salish tribe on the west coast and Fraser Valley in British Columbia. And I work on a contract basis with the First Nations Emergency Services Society, and my contract has just expired. So I was fortunate enough to meet Kirsten Ma at a climate conference in Nanaimo. And through that conference, she invited me to join the Hot Topics initiative. And that led me to working with Sarah and Erin on this project. So I'm very grateful for that that series of events that occurred to bring me to this, which then finally allows me to be here as a presenter. So I work as a civil engineer, and I've worked for almost 20 years now in this predominantly indigenous engineering and planning projects. So I have a lot of experience in emergency response and emergency management, and some in emergency planning. And that gives me some, I guess, context to the work that's being done here. I think one of the most interesting stories I heard in respect to vulnerable populations and access to heating and cooling centers, including, I would say, basically dealing with today's world, which includes fires. And in an emergency situation, an individual who is handicapped in a wheelchair needed access to a vehicle that could help transport them. And that vehicle was not available so easily for the community. And it resulted in them, fortunately, borrowing a vehicle from the neighboring city or municipality that had a wheelchair accessible vehicle that could help with the transport. So that to me shows how much of a need there is for vulnerable populations to be able to access these much needed resources and infrastructure. So yeah, I was just completely blown away by the fact that that was overlooked, and that those types of issues occur commonly, and especially in rural communities. So in one of the sessions that we hosted, there was a community that shared their needs and their lack of resources, specifically internet and telephone landlines, as well as access to a community center. Those are some issues that came up for me that I wanted to share with everyone here today, and that those issues can be resolved with the work of partnering with your neighboring communities. So I think that's a good lesson to be learned from those stories. There's a lot of opportunities for, in this case, a First Nations community to work with a local, regional, district, municipality, or city. And so I think that was something I really wanted to get across in this storytelling mode. And I've really enjoyed working with Sarah and Erin and the team, coming up with some solutions, coming up with some ideas, and just in general having the opportunity to discuss and share different points of view with each other. And I think that is going to lead to a very, very useful guidelines and story to be shared from this project. And yeah, I just want to say thank you so much for inviting me to share my story.
Thank you so much, Kristopher. So next, I'll be sharing a little bit of the context, and this is coming from our literature review, as well as key informant interviews that we did early on in the development of this project. So in thinking about this particular subject matter, we cross many different environments within the government and within local, regional, and provincial spaces that often are quite siloed. And there's many, many different actors involved in these situations, as well as policy makers and the policies themselves. So this spans across several different, often siloed spaces, including health, environment, emergency services for acute emergency response, as well as long-term response, which can include housing, transportation, debris maintenance, et cetera. So what we found through a lot of our conversations is that that funding for acute events may be available, although a lot of the local planners that we spoke with shared some responses to how that funding gets acquired. But that is often separated from long-term response planning in terms of prevention planning, as well as long-term thinking for rebuilding. So these funding pockets are all situated within different spaces and are often not worked on collaboratively across these many actors or agencies. Prevention appears to be an afterthought based on our conversations and the literature, though there does seem to be some funding for that. There's other considerations within these governance spaces that impact people's ability to access that funding or to make it fluid enough or flexible enough for the needs of their communities, given different types of disasters and different types of vulnerabilities that can occur under specific contexts. So we tried to really frame this problem through those perspectives. So thinking about this fragmentation within the jurisdictions and also fragmentation around responsibility, who's responsible for what and at what point within the disaster cycle. Alert systems are often inconsistent in terms of differing temperature, as an example. So what thresholds or triggers, depending on where you're situated within the province, impact your ability to gain access to funding or gain access to other resources. There's also shifting definitions and experiences related to vulnerability. So as Kristopher shared, when we're talking about somebody who has a physical disability, that vulnerability presents itself in really particular ways during a disaster. And depending on the type of disaster and how much foresight can be allotted to that situation. So if it's a disaster that is unexpected and immediate, that can be a really different resource need than a disaster that is kind of seen coming, and plans can be made in advance for dealing with those kinds of situations. So those vulnerabilities come up in different ways. And it makes it really difficult to create policies, because policies are often fixed in specific language, fixed in specific ways of approaching situations, and don't provide necessarily the level of flexibility that a disaster can present on the ground, especially in a local or regional context. So some of the key considerations that we're looking at in particular are preparedness is often not covered by governmental agencies. So local authorities or not-for-profits are filling those gaps, and it's often in an ad hoc manner. So we wanted to kind of unpack that and try to understand how those gaps could be filled using these recommendations as an outcome of this work. We have also identified and are discussing different approaches for thinking more holistically about the entirety of the disaster management cycle. So if you haven't heard that term before, that means that we're talking about mitigation, preparedness, response, and acute and long-term recovery. We also are very curious and excited in a way to illuminate this concept, because oftentimes vulnerability and resilience in the literature and in government documents get set into a binary, but we understand them to be quite fluid, and that we're vulnerable in different ways at different times in different seasons of our life. And we're resilient in a lot of ways as well. And how can we build out the structures of resilience, which would be more community engagement, more community protective communications, right? Trusted relationships. But also understanding that, again, vulnerability can change. So one of the examples that Sarah and I both have lived experience with is being pregnant during a disaster event, including a heat dome. And so your vulnerability changes through the seasons or cycles of your own life. And so just kind of understanding those differences, and not seeing it strictly as a binary. So with that, we'd like to share some of the preliminary findings of our work. So just to say, first and foremost, this work is still ongoing. This survey is still open. So as of right now, we've sent our survey to over 400 emergency coordinators across the province. Our current response rate is around 10%. So we've got about 50 responses so far. Our aim is to have a statistically significant response rate of about 20 to 25%. So we need to double or triple that number of responses, and we're in the process of figuring out appropriate ways to do that through snowball sampling and other approaches to getting these surveys directly in the hands of people who are emergency coordinators, either officially within their title and within their work, or are leaders within their community during emergencies. The questions are quite broad, but they're camped within these specific spaces of demographics, just to try to understand the population that we're working with, employment status. We also ask questions about individual and also community health impacts of this, of being an emergency leader. Access to barriers. We're very curious about communication and the way it works in small towns versus cities, and trying to get information from the provincial sector down to these small towns. There's a lot of questions there that we think are important to try to highlight and illuminate through the survey. And then we're asking for people from a place of hope and future thinking to share their own suggestions for policy strategies. So you'll see here on the right just a snapshot of one of the questions in particular related to the health concerns for the emergency coordinators themselves. So you can see that many of them do feel that their overall health or quality of life has been impacted by these extreme weather events. We were extremely fortunate to have someone come and do a visual representation of the themes that have come up through this work. So we just wanted to share this beautiful image with all of you. And in particular, you can see that our key themes come up in this. So that's governance and decision-making, communication and engagement, infrastructure and safe spaces, and thinking through communications as well. So here they are again listed: governance, communications and public engagement, infrastructure, safe and inclusive spaces, and administration and human resources. So as Sarah mentioned earlier, in addition to our survey, which we're trying to get as broad a perspective as possible, we've also held these regional care circle conversations. And so we'd like to highlight some of the conversations that have come up under these themes within those regional circles. So this one in particular related to governance came up during one of our interior regions. So this is the interior of BC. So again, talking through that concept of getting access to funding and how these issues around temperature triggers allow for access to funding. So this individual says it's very difficult, like even to get a task number, there's so much bureaucracy. You might not even get covered, even if you do everything that you think you're supposed to do, you might not even get those resources in the end. And that this is at all levels of government, they're seeing this particular issue within their work. And it's very much left to the community to figure it out with those limited resources and perhaps limitations in staffing. So that's just something that we felt really illuminated this issue of governance at all levels and relationships at all levels. In terms of communications and public engagement, we found it particularly interesting talking to people who lived further and further away from cities and the impact of city-centered policymakers and city-centered communication strategies not really being effectual for people out in smaller and more rural communities. So in particular, this person is illuminating the fact that many people in their community do not have access to internet, and this is in the northern region of BC. And for many years, people lived off of landlines, but now all of those landlines have been taken out. And so communication is really incredibly difficult, especially if you don't have access to internet. And oftentimes what happens is that individuals or an individual from the local government has to go out individually to households to try to get information to members of the community. So it's just something to think about how we communicate and creating effective and dynamic communication strategies for public engagement. In terms of infrastructure, safe and inclusive spaces, again, we come back to this idea of governance and this idea of funding. So thinking about the EMCR for funding, it's not released until an event occurs. And so oftentimes the staffing just isn't available. And even if there is infrastructure in these rural communities, which oftentimes is questionable in and of itself, that infrastructure hasn't been updated for the purpose, like doesn't have a proper HVAC system to create a clean air space. And where is that funding going to come from? And where is the funding for staffing going to come from to extend the hours of the use of these spaces in general? So there's a lot of questions about the age of infrastructure, the ability to get funding in a planning stage so that the buildings can be upgraded purposefully for the potential intended use during a disaster like a fire or a smoke event in particular. And finally, administration, human resources, and workforce capacity. So one of the things that came up that was discussed a little bit earlier is really a lot of communities, no matter where they're situated, rural or urban, are leaning very, very heavily on community social services and not nonprofits. And there isn't necessarily a relationship that allows the funding to be transferred from the provincial EMCR down to the social services who are actualizing a lot of the care and support for community members. So, so including those community social services supports into the conversation throughout the entire disaster management process is going to be incredibly important for the future of this work and properly planning. So I'll pass it back to Sarah to start us off in closing the circle.
Yeah, so for every climate care conversation that we've held, our sort of last slide has always been closing the circle and what's a key message that you want to share with everyone today. So similarly, we'll pass it around for each of us to just share a few words of closing. And one thing that I'll just emphasize is, as Erin said earlier, our work is ongoing. And so our project will wrap up formally with our deliverable to the Ministry of Health by the end of the summer. But we're committed to this work, and we're looking at ways to continue the partnerships and to keep cultivating a community of practice in this area. I think it's such an important area, connecting health equity to emergency response and planning. And so I'm hopeful that through, CBRC and other avenues, there'll be ways to continue these conversations. So yeah, just expressing gratitude for the work and commitment to moving it forward in a good way. Maybe I'll pass it over to Kristopher for a few words.
Right, thank you. I would probably just say that my closing words would be knowledge transfer and sharing of information is important. And I think that's what we're doing here, and taking information and knowledge from community and coordinators and relaying that to the government and policymakers. Thank you.
Thank you both. I think my closing thought today, I love reviewing this information because every time I do, something else floats to the surface. And so for me today, I'm really thinking about the concept of integration and true diplomacy, which means talking to everyone, inviting everyone into the circle to have the conversation because everybody is impacted by this work in some way or another. So really getting an expanded number of voices in the room so that we can truly care for everyone. During and in the rebuilding after a disaster event because they are happening and they are happening more frequently. So we really need to take that information and use it wisely so we can care for the future. And I'll pass it back to Sarah just to share a little bit more about, again, this ongoing research and if there are ways that folks in this space can support us. These are some of the ways to access more information. And Sarah, if there's anything else you'd like to say in closing.
Yeah, here we have, this is our survey flyer on the left, which is available for distribution, focused again on British Columbia. So we'll have this with our slides that I think will be posted on CBRC's website later. Our project email is climatecareUvic@gmail.com. So that's a good way to reach us. And there's a link to our survey. And we also have a project website with a little bit more information, and maybe we can even link to this webinar later through our website. And I think we have maybe one last slide, which is just Erin and my contact information as well. So an invitation to reach out directly if you're looking for any more information. But I think that brings us to a close, and we'll look forward to some discussion. Thank you so much for your time today. Thanks for listening.
Thank you so much, all three of you, Sarah and Erin and Kristopher. It was wonderful to hear all of your perspectives on this project and hear from you as you shared different aspects of this project with us all. So we'll open it up for question and answer now. We only have about 15 minutes. So if you do have a question you'd like to ask the presenters, please get it in the chat box now, and we will read through any questions that come in. And maybe I'll get us started. One thing that's kind of on my mind right now, because it's the topic of our community of practice meeting tomorrow, is thinking about entry into community when you're doing a research project where you are collaborating with different community members and organizations like you have here. So I'm wondering if you can speak to any perhaps pre-engagement or pre-standing relationships you had with some of the communities you engaged in this project, and kind of what voice did community or organizations you were partnering with have in shaping this research?
Yeah, I can go first, and I think Christopher's having a little bit of a tech challenge there, so maybe you can fill in after. But in respect to this project, we actually didn't really have established relationships. So
Mm-hmm.
it took a lot of careful building in the first year. And I
Mm-hmm.
think the whole first year of our project was all about relationship building. And it was really wonderful to be able to work with Kristopher and our colleagues through the First Nations Health Authority, because they have a lot of
Mm-hmm.
really direct relationships and connections, and the email contact information for all the emergency coordinators. So I think taking that time and care to build that relationship, or I should say those relationships, was vital to this work and is vital to this work.
Yeah.
And I think that's really hard because initially the project was structured as like a 1-year grant, and we were able to get an extension because you need that time to build those
Mm-hmm.
relationships. And so that's one thing I always think about in relation to community engaged research, is that like timelines need to be a bit more fluid than the rigid sort of grant cycle. And while,
Mm-hmm.
the policy folks might have their timelines, communities have their timelines, and so that flexibility is really critical.
Mm-hmm. Mm-hmm. Thanks for sharing that, Sarah.
I don't know if Erin or Kristopher, you want to add anything else about that like process of relationship building.
I think the one thing I would just add is that it really is about trust and
Mm-hmm.
trust building. So especially communities that have had a lot of extraction of their knowledge and a lot of extraction in a variety of other ways, often by settlers and often, to be honest, by researchers. I think just taking the time to build a trusted partnership with one or two individuals so that like that unfolds. And you know what I have been trained in is that like it can take sometimes that trust, if it's immediate, right? Like there's a link that just happens, but that's a magical thinking kind of thing
Mm-hmm.
that is not often the case. And so sometimes it's just a genuine kindness and care, and then that builds and builds and builds into a trust relationship,
Mm-hmm.
and that can take 2 years, 5 years, 10 years. So if you're really committed to this work, then just try not to rush the process. Like really, really be intentional with your relationship building. And even if the funding dries up, it's like how are you going to keep the momentum going while you figure out the next step is really
Yeah.
important to think about.
Mm-hmm.
If I may, I'd love to just speak to a question. Is that okay?
Let's give Kristopher a chance
Sure, of course.
to respond to this, and then sure, Jamie, go ahead after we hear from Kristopher here.
Yeah, I would just say that yeah, my whole career has been based on relationships. And
Mm-hmm.
so I have a lot of very, very strong relationships with communities, with leaders, and it benefits projects that I choose to work with. So my choice to work with this project really helped. I think, especially for the northern communities, we had a really good engagement with one of the communities from the north that brought a perspective that was um, overlooked or not known about, and I think that
Mm-hmm.
was really helpful in this situation.
Mm-hmm. Thank you for sharing, Kristopher. Uh, Jamie, we can go to your question.
Yeah, great. I just wanted to first thank you. This is like super applicable to the work that I do. So, and I felt like I just wanted to make that connection. So I'm a researcher at Selkirk College in the southeastern corner of the province. And this is really great because my background is climate change and working with unhoused residents. And so I'm currently have a regional project working around supporting unhoused residents in the West Kootenay, so Cascar, Nelson, and Trail. So we've been working for 3 years and we have a lot of the relationships.
Mm.
So one thing is that I do invite, I can always put my email in the chat. It'd be so great to have an email invitation with kind of what you're looking for your survey, and then I can forward it to our network that we have relationships with. And it's interesting because I've noticed, and we weave in the climate emergency piece with this all the time. Like, it's really within a lot of the work that we do. And I just really appreciate that kind of focus specifically on that intersection within the work that you do. So I'm more just wanted to make that connection, really excited to see what you learn from it, because it's something that we're constantly working with here. For example, in Trail, BC, one of the communities in our region, they're always struggling because they don't make the threshold for cooling centers early enough. But the downtown core of Trail, BC, where a lot of our unhoused residents are, is so much hotter and doesn't than the surrounding areas that are used for the thresholds for the policy. So I know it's something that through our applied research, we've been trying to continuously bring up to policymakers in the region, and I know that it's working, but mostly I wanted to make the connection, really excited about this work, and I wanna pay attention and see your results as they get published. So thank you.
Yeah, thanks so much, Jamie. We'll definitely make sure that we follow up with you and share more information. And even what you just shared is so illuminating about the thresholds and the heat temperatures as they differ within local regions as well. That's so important, and it reminds me of the challenge of policy that sometimes has this like blanket approach to things when there's a need for that kind of variance, even in temperature thresholds. So I really appreciate you sharing that. Oh, awesome. And I see your email there. That's great. Thank you.
Excellent. That's always nice when we see folks doing that bit of networking and connecting throughout these events. That's certainly one of our goals at CVR Canada. So thank you, Jamie. I'm not seeing any other questions in the chat, but maybe I'll kind of pick up. There's a couple other directions I thought I could maybe take questions in. And maybe just related to Jamie, what you were saying there, the interest in how do we I guess get this information into policy makers, not just into their hands, but really into their minds and their way of thinking. And Kristopher, that was your kind of closing thought, was about knowledge mobilization. So I'm wondering if any of the presenters would like to speak to any maybe strategies you've used previously in research or strategies you're planning to use for this project to really try to ensure there is that action orientation, or that the findings that come out of this do make their way into policy. And I can already see, just by the way you've set up your research, you've set yourself up well for that, but wondering if you'd like to expand on that at all.
Yeah, that's a great question. I can start us off with the answer. So on my list this week, actually, I think it's today, I was planning to follow up with the Ministry of Health, who's, the funder for this research, and say, what format do you want our results in? Do you want a report? Do you want a webinar? Do you want like an in-person briefing? Do you want our peer-reviewed articles? Like what exactly do you need? What is the most useful? So I feel like asking the policy folks kind of what they need is helpful. And we did have one person from the Ministry of Health at the CARE Assembly session, and they were there for a half day. A lesson learned for us is don't plan an event over a long weekend on a Friday. So that is definitely a lesson learned that I will share. That was maybe an oversight on my part, because a lot of people were away. We had a great turnout of about 30 people. Initially, we thought, let's get 50, but I do think 30 was a good spot because we could have actually conversations with everybody in small groups. I think the bigger the event, the less kind of intimate and in-depth conversation you can have. So I think 30 was quite a good number. It would have maybe been nice to have just a few more from the Ministry of Health there, but I think they're mostly interested in, the results, what we hear. So I imagine what I think that might look like is preparing some kind of report, and then also doing a presentation with their staff, and then eventually sharing like peer-reviewed articles. I at one point did ask, what's useful to them, and they did say those peer-reviewed articles are useful because they can use it in their briefing materials as well as they're trying to do evidence-based policy. And right now I have the privilege of teaching students about policy making, and that's the one thing that, like, no matter your ideology or your background, the one thing we can kind of agree on, I think, for the most part, is evidence-based policy. You need the data, you need the evidence to make your claim. And I think what we're trying to do with this research is have a balance of different kinds of data and evidence including the statistics, but then also the stories. And that's a real big part of this, is having, your statistics, your numbers, but then also that qualitative in-depth story as well. And that's part of my like policy advocacy, is making those voices count just as much as numbers do.
Yeah. Thanks, Sarah. I think that's that great advice for folks who are really starting to think about how to make research a little bit more meaningful and practical and action oriented.
I think that the only thing I would add to that is that I've been really excited about the American Public Health Association has really tried to initiate an idea of public health in all policy. So so again, just coming back to the idea that like these things are impacting every single area of government. And so anywhere that we can get the language of adaptation, resilience, community support, just like thinking through what the future is going to look like with these natural disasters, like in all segments of government, big and small, and really just trying to think through like what the language can look like and getting it into more spaces, I think is what motivates me. I'm hopeful.
Yeah. Thanks, Erin. I think you pointed out there one of the kind of inherent difficulties of policymaking in government is that government departments are all fragmented and somewhat siloed sometimes, where the department that thinks about environment is different than the one that thinks about health, is different than the one that thinks about social policies, and when we do have these issues that intersect all different departments, it can be tricky to bring people together, but we do need to think about them holistically like that, and perhaps think outside of the box to what types of policymakers or advocates could be relevant to our issues. Kristopher, is there anything you'd like to add to answer that question or wrap up the question and answer period today?
I think from my experience, post-secondary institutions have become a little more ethical in their work, especially in regards to indigenous knowledge and working with indigenous communities. And so for that reason, I've been a little more open to doing this type of work. And I'm really glad that I took a chance to work with Erin and Sarah on this project. And I'm really pleased with the results that we've come with so far. And I know that my own college that I went to college for a civil engineering technology diploma reached out to me to help quote unquote indigenize the civil engineering program. And I just said, okay, I really appreciate that you've reached out to me, but when you can do a little research on decolonization of post-secondary institutions and then come back to me and have that discussion. But until then, like, I'm not here to paint your program red if that's what you're looking for. And so since then, I've found a lot of professors and leaders at those institutions are starting to acknowledge that that whole process of the decolonization, and I think that's going to lead to better results and more encouraged participation from indigenous knowledge keepers, and share that information that I think is quite vital to the success of both the world, environment, and Canada.
Thank you for sharing that. And it's actually, I think, a little, it's a positive sign that you're seeing that change in institutions. Change happens slowly, but that's a very important change that institutions have been having to make. And, as CBR Canada, we advocate for is how can institutions, both the individuals within institutions, but also the way institutions present themselves, really align with some of those things that they say they want to do or be engaged with, and really being able to walk the talk and show with authenticity that there's alignment in values and beliefs. And when we talk about things like equity and diversity and decolonized ways of thinking and knowing, for you to say that you've seen that shift, that's positive to hear. So thank you for sharing that. We're just about at the end of our time today, and we promised we'd wrap up on time. So I will kind of rapid fire go through our closing here. So I'll just get back to a couple closing slides here. And Natalie, my colleague, will be pasting some things in the chat for you folks. But just wanting to point out that you can find past recordings of all of our events online at our website under the resources section. There was actually a previous webinar that Sarah, that Dr. Wiebe had done for us as well. So you can see a previous project she showed, as well as the previous projects within this theme of community-based research responding to environmental and climate crises. You can also stay in touch with us by signing up for our e-news if you're not already, to learn about our upcoming events and other programming that we offer. And we have next week on Thursday our kind of final event in this series, which is not so much a webinar, but a live discussion. So this will be a chance for all of you, for anyone who's attended any event in the series, to be part of the discussion, to share thoughts and insights with others during this interactive and participatory discussion next Thursday. So we hope that you will be able to join us to be able to not just listen, but also share in that discussion as we wrap up this theme. So thank you so much, everyone, for joining us today. Thank you for those who asked questions. Thank you to those who might be watching this recording in the future from now. And of course, thank you to our three presenters, Dr. Sarah Marie Wiebe, Dr. Erin Nuckols, and Kristopher Peters. We will see you all hopefully next week. Thank you, everyone. Bye for now.
Thanks so much, Amanda.
Take care, everyone. Thanks for coming. Thanks for listening.
Bye. Thank you.